Welcome to our Fallbrook Climate Action Team meeting. And tonight's speaker is Dr. Wilma Wooten, who is the Health Officer for the San Diego County Department of Health and Health Services. For those of you who are not familiar with our group, we are a group of local activists for climate change, and we present monthly meetings on ways to reduce our climate footprint and to mitigate it. We have two meetings coming up in July and August. Our July speaker will be Dr. Ralph Healing, and he is a biochemist at Scripps. And he is in charge of the CO2 program at Scripps. In August, we have Rosalie Dito, and she's a FCAT member, and she's done extensive research and experience on California natives. And she will talk in August about the plants that you can plant in your yard. And just to let you know that while Dr. Wooten is presenting, your audio will be on mute. And if you want to add, if you have any questions, please put your name and contact info and your name and question in the chat. Well, with much ado, here's Dr. Wooten.
Well, good afternoon, everyone. I'm going to bring my slide deck up. Just give me a couple of minutes here, or seconds. Okay, now I'm going to share. So can everyone see my slides now?
Yes.
See your screen.
Yes. All right, thank you so much. Well, thank you for the opportunity to share my presentation with you this evening. And for probably about the next 40 minutes, we will share with you these various sections. What is the problem related to climate change from a public health perspective, and who is at risk? And then I'll share with you impacts of extreme weather and climate change. And there are three major areas that our public health department works on with community partners. And the first is excessive or extreme heat. The second is wildfires and air quality. And then the third is vector-borne diseases. Then I'll share with you what has the county public health services department done, and then what can you do, and then we'll provide some resources. And this PowerPoint can be made available to your members and individuals that might visit your website if you'd like. So the first section, what is the problem and who's at risk? So what I want to start out by sharing with you that the Intergovernmental Panel on Climate Change, also referred to as IPCC, has issued several new reports, and this organization has provided the latest health check of the Earth's climate, and it basically has very grim news, and that is that human activities have been driving up the planet's temperature. This group is the utmost expert on climate change. So there are two reports that I encourage you to check out, and the link is at the bottom of the slide. But in February of last year, they issued a report on the impacts, adaptation, and vulnerabilities related to climate change. And then last April, mitigation of climate change. So again, encourage you to check out this particular resource. Climate change has been identified as a public health crisis at all levels of our public health. From the World Health Organization, the general director has stated that climate change is a health crisis. The same unsustainable choices that are killing our planet are killing people. Likewise, Georges Benjamin, who is the executive director for the American Public Health Association, states that climate change is one of the most serious public health threats facing our nation, yet few people are aware of the very real consequences of climate change on the health of our communities, our families, and our children. So looking further, in 2019, there was a call to action by an organization of many health related organizations, including the American Medical Association, and they issued a call to action to governments, businesses, civil society leaders, elected officials, and candidates for office to recognize the fact that climate change is a health emergency, and to work across governmental agencies and with other communities and businesses to prioritize actions on the report that they issued. It was called the Climate, Health, and Equity Policy Action Agenda. And then if we drill down further to California, there have been several action plans released by the state, one particularly on public health. The comment here is that the most immediate and concerning impacts of vulnerable populations continue to be extreme heat and air quality, which we will talk about, as well as intermittent years of extreme precipitation, such as El Nino years that can cause coastal and riverine flooding and extreme prolonged drought. Combinations of climate hazards can occur simultaneously, synergistically, cumulatively, or even in sequence. And we know all too well that when we have fires followed by rains, then we have landslides. That is a factor in many parts of the state of California. So the question, and I'm sure everyone knows this answer, but who is at risk for the effects of climate change? And no surprise, the answer is that everyone is at risk, from the very old to the very young, women that are pregnant, men, women, no matter what the sex, again, and the age. Everyone, it can be impacted, even those individuals, and especially those individuals that have chronic medical conditions, or individuals that work outside and are exposed to excessive temperatures and heat. So this premise or framework is from the CDC, and it was adapted by the California Department of Public Health. And our Public Health Services Department has been using this framework model since about 2015. There are 5 components. The first is to forecast the climate impacts and assess a region's vulnerability. And we will be talking a little more about that in a few minutes. The second is to project rather, the disease burden. What is our risk, and what is the disease burden for those factors that affect our region? And then after we know what our burden is, come up with interventions to address those particular issues, then develop and implement an adaptation plan, and then lastly, evaluate the impact and improve the quality of activities and start all over again, because as time progresses, these factors may change. Now, regarding the first step, which is looking at the vulnerability or conducting a vulnerability assessment, the California Department of Public Health did this first in 2016. And there are 3 domains where over 20 indicators were identified. The first domain is environmental exposure. The second is population sensitivity, so what demographics are most impacted, and the last is adaptive capacity. What are those factors that have an impact on how someone is affected by climate change? And so the top 5, and this is specifically for San Diego, the state conducted this a vulnerability assessment for all counties within the state. And for San Diego County specifically, there were 5 top indicators as indicated by these green arrows. So in the first domain, environmental exposure, heat, obviously, and wildfires were identified as higher risk vulnerabilities for our county relative to other regions. And then in the third domain, adaptive capacity, there were 3 conditions identified: air conditioning or lack thereof, tree canopy, lack thereof, and impervious surfaces. Impervious surfaces basically means those surfaces like concrete or densely populated high rises that collects or absorbs heat. So these are the 5 areas identified in the vulnerability assessment conducted by the California Department of Public Health in 2016. Now fast forward to 2021, and they repeated the assessment, actually 2022, and the assessment was repeated. Now the good news here is there is a tool called CHIVIS, the Climate Change and Health Vulnerability Indicators, and this is where the state provides the data for their vulnerability assessments of all of the 58 counties in the state. And again, this is specific to San Diego County. The red line is the state's average. So those indicators that are above the state's average, as are these 10 indicators here, these are the ones where if you want to make a change or do something to address this issue, these are the areas that are recommended. And I'll just point out the top 3 here in San Diego is the percentage of individuals or populations in very high wildfire risk areas. Also the percentage of impervious surfaces, and then the percentage of households without air conditioner. And I'll read the next 2 as well. The mean PM 2.5, that's particulate matter, 2.5 concentrations. PM 2.5 can be caused by air pollution, but it also can be caused by wildfires. So for San Diego County, that was above the state median or average, state average. And then the percentage of percentage household without English speaking capacity. So again, these top 5 are those indicators that are significant for San Diego. You're just going to go down to a percentage over 65 years of age and the percentage without health insurances. All of these, again, are above the state average. Now, if we go to the next slide, that point about air conditioning, only 56% of San Diego residents had air conditioners at home. 14 or almost 15% of residents own an air conditioner, and 41 or almost 42% have central air conditioning. So when we have excessive heat, many people do not have air conditioners in their home. That's why the county has established cool zones. And we actually had a press conference today announcing the over 40 areas, actually 60 areas in San Diego County where people can go if they do not have air conditioning in their home. And in addition to that, they can call 211 to find out where the nearest location is to them. And 211 will provide resources to transport them to a cool zone if they do not have that capability. So in this next slide, I wanted to share with you some more information: occupational health related illnesses, heat-related illnesses. Heat-related illnesses in this particular slide were reported by California workers between from 2000, it increased up to 2017, and that's how far the data goes. So you can see by the graph of histograms on the left that since 2000, the heat-related illness rate per 100,000 of occupational heat-related illnesses in California has continued to incline to, excuse me, to increase up to 2017. That's as far as the data is available on this particular slide. If we look at the graph on the right side, this is the rate of heat-related illnesses per 100,000 individuals by a GIS map. And you'll see at the bottom here that the county of San Diego is second next to Imperial County, and above Los Angeles County as having the highest rate of heat-related illnesses in the state. And this is a very important slide here, one of my favorite in the slide deck tonight. This is a slide showing urban heat island effect, comparing rural, industrial, downtown, park, and suburban areas, and where the temperature tours are in these various regions. And you'll see that downtown areas have the highest heat factor, both during the day and during the night. And the next couple of slides are GIS maps showing the urban heat islands by district. This is supervisorial districts in San Diego County. So this is an example here of District 4, and you will see, based on the legend, the low heat island effect is a kind of a teal color, and you see that that's closer to the coast. And the farther east and inland you go, the island effect becomes higher, closer to red. So here it goes from the green to orange. And the bottom, just wanted to make sure we showed what, being in Fallbrook, you are in District 5. Obviously, because there are not a lot of large urban centers in District 5, we do not see a geographic kind of a coloration here, because we don't have that effect, which can be good. But on the flip side, we know that areas like Borrego during the summer months, people that live in those areas suffer due to excessive heat. So that's why our libraries in the area have extended hours so people can go to the library as a cool zone. Now, from these vulnerability studies and from information that CDPH, the California Department of Public Health, they adapted this framework from CDC. And for San Diego County, what we did is to look at what are those areas that we, as in the Public Health Services Department, that we are working on and can do something about being part of our programs in the county here. So for public health services, the three areas that are circled: excessive heat or extreme heat, wildfires and wildfire smoke, and then changes in the vector ecology. Those are the three areas that I will focus on in most of the remaining presentation tonight. So we'll start out with excessive or extreme heat. So everyone is aware of the July 2006 heat wave, but I can tell you that we've had cool zones in San Diego County since 2001. However, this heat wave in 2006 was unprecedented, not only in California, but nationwide. In California alone, we had 147 deaths that were specifically associated with hyperthermia. All other deaths were due to exacerbation of chronic health conditions like heart disease, asthma. And then we had 450 to 600 plus individuals died in a few days during this July heat wave in 2006. There were 16,000 excessive hospitalizations as a result of this heat incident. California heat wave activity has been increasing over the past several decades. specifically at night, where we see humid nighttime accentuated heat waves being associated with increasing in heat over the past years. And the state of California graphic that you see here, this shows deaths due to heat by county. The larger the circle, the larger the number of deaths. The small circle is 1 death, the next size is 5, and then the largest is 10. And you can see in central California, that's where most of the deaths occurred. Moving to the next slide, I want to share with you changes that have been seen in the US, in California, and then also in San Diego. So starting with nationwide, CDC recent data estimates that in the United States, on average, 702 heat-related deaths occur each year. And each year, there are 67,512 emergency department visits and 9,235 hospitalizations due to heat. If we go or drill down to California, heat-related hospitalizations from 2000 to 2020, this was 13,042 hospitalizations. For ED visits from 2005 to 2020, 77,259. And if we drill even further down to San Diego, we're looking for San Diego at the time period from 1991 to 2019. We had 2,733 heat-related illnesses visiting our emergency departments across the county, and 641 people were hospitalized and 72 unfortunate deaths occurred. Now, I want to share in this slide, this is research that was conducted by these researchers looking at extreme heat and hospitalizations to inform early warning systems. And it looks specifically at hospitalizations and the types of hospitalizations. What I want you to focus on is the extreme area here. And you can see that for all of these hospitalizations, the number of hospitalizations per summer, all-cause hospitalizations, California had the highest number. For cardiovascular-related hospitalizations, again, California, when looking at compared to other states. For all respiratory-related hospitalizations, New York was the highest, California was second compared to all other states. And then diabetes-related hospitalizations, fluid and electrolyte disorder-related hospitalizations, and renal failure-related hospitalizations. Again, California was the first. So this is very important for us to know that our state, not only is our county of San Diego at increased risk, but our state is at increased risk for heat-related illnesses in the form of hospitalizations presenting to the emergency departments when we have these heat waves. This slide shows heat alerts that have been issued over time, and this particular table compares 2012 down to 2022. So for a 10-year period. And you can see 2020 had the largest number of heat alerts. And this information was generated and helps us when these heat alerts are issued. It helps us to determine if we are going to activate our excessive heat task force. And when there's phase 1 where we are watching and we might get an advisory, phase 2 is associated with excessive heat alert, and phase 3 is excessive heat warning. And there are different actions that take place in each of these phases, with the most extreme being that we bring our task force together, sometimes for phase 2, but always for phase 3, so that we can make sure that all the resources available that we have for county residents is deployed, and we communicate to the public via via news stories, so that people can know where the cool zones are and what other actions they can take to protect themselves. Now, when we do have excessive heat events, the common medical illnesses related to excessive heat come in the form of heat cramps, which is associated with heavy sweating and painful muscle cramps. So this would be the milder form of these three conditions. Heat exhaustion can occur and be associated with heavy sweating, weakness, fatigue, headaches, dizziness, vomiting, and nausea, fainting, irritability, thirst, and decreased urine output. Heat stroke is a medical emergency, and this is when you have a very high body temperature. The thermoregulation, the thermostat of the body, that whole system is disrupted. Sometimes people may not sweat at all. In these first few conditions, drinking fluids is important, but when you are experiencing heat stroke, you don't want to consume a lot of fluids. The important thing is to cool the body down, whether with heat packs or ice. And also, individuals that are experiencing a heat stroke, really, as I stated, it's a medical emergency and they need to be transported to the emergency department. So if someone is with this individual, they need to call 911 so the person can be transmitted to the emergency department. So talking about a heat stroke can damage the brain, the heart, and the kidneys. And these are very important organs of the body that regulates our body functions. So it's very important, again, as we stated, heat stroke is a medical emergency. So we need to get an individual to the emergency department as soon as possible to protect these organs. And just as with other conditions, those individuals that are most vulnerable include individuals with pre-existing chronic diseases, as well as individuals that are older, individuals that live in poverty or isolated due to the fact that they are living alone or are homeless. So also, it is important to note that certain medications can have an impact or increase one's risk for heat-related illnesses. And this is basically probably most in any medication that you're on, particularly if the medications are cause you to lose fluids like diuretics. But antidepressants, anticholinergics like Benadryl, central nervous system stimulants, heart medications, we talked about diuretics, ACE inhibitors, ARBs, beta blockers or calcium channel blockers, antipsychotic medication, insulin. Insulin can damage, heat can damage insulin itself, making it less effective if you don't have it refrigerated, or if you're keeping it outside. Maybe, and people might be traveling in their cars and may not realize that. And so it is important not to store insulin in a hot place, like a car, as I stated, or direct sunlight. And also, commonly abused substances also increase the risk for heat-related illnesses, and those include alcohol, cocaine, and also medications that cause you to lose fluids. So any type of caffeinated drinks should be avoided if you are exposed to excessive heat. Now, I'm going to move next to wildfires and air quality. So probably about 20 years ago, it was thought that wildfire season is only in the October, November, particularly October, maybe September area. Now wildfires occur year round. We just had several wildfires this past weekend. that were quickly put out by our local firefighters. This slide shows the acreage that has burned in California between 1950 and 2022. And you can, if you turn your attention to the right side of the slide, you can see that in 2020, over 4.2 million acres of land was burned. And in 2022, which is the last bar there, just about 420,000 acres were burned. Now, this slide shows fire hazard severity zones by district in San Diego County. So we are comparing District 2 with District 5. The important thing here to note is that the fire hazard severity zones, moderate is beige, high is orange, and red is very high. And as you can see here for District 2, most of the entire district is red, which is very high. And for District 5, you can also see that most of that particular district is also red. So, and we know that San Diego County has a very high fire hazard severity condition. When we do have wildfires, there's ash. And the very fine particulate matter that's created as a result of these wildfires is called particulate matter. Particulate matter that is 2.5 micrometers, which is about the size of a hair, and we'll show that in the next slide. These particles are very fine, so they can go beyond the nasal cavity. They can cause irritation of the eye, lungs, and the throat. They can affect breathing, particularly in those individuals that have asthma and exacerbate or cause asthma attacks. And it can worsen heart disease and even cause premature death. So the drier it is, the better our terrain burns. And then wind can also spread fires. And many of our fires are due to negligence caused by humans. Then after we have fires, I stated earlier, it makes the land very ripe for landslides. After you have the fire, then you have floods, then that's followed by landslides. So a lot of different conditions occurring in tandem with each other that can cause human damage as well as damage to our property. So this is what I alluded to on the last slide. A particulate matter at about 2.5 micrometers is about the size of diameter of a human hair. So it is very important that we become familiar with this and know that it can cause these health conditions. In this next slide, this is wildfires, smoke, and public health. So this is looking at air pollution primarily through the particulate matter 2.5 and generated by wildfire smoke events is associated with an increase in hospitalizations, mortality or deaths for respiratory, ischemic heart disease, and heart failure, and even birth outcomes. So in the bottom right slide, this is the mean rate of respiratory admissions. And you can see, and this is San Diego starting on the coast, and it is most of this coastal area and even east, you can see that there is an increase in the rate of respiratory admissions. And then this is on the left side is particulate matter 2.5 locations throughout San Diego County, primarily on the coast from 1999 through 2012. Both of these are, graphics both are for the time period 1999 through 2012. And then overall particulate matter 2.5 is decreasing in California, but the particulate matter 2.5 from wildfire smoke is expected to increase over time. And that is as we have more fires. I can say that the county has implemented since 2003 many actions to help decrease the impact of wildfires. One is the promotion of defensible space around the home, having more succulent landscape as opposed to shrubbery or trees that are easily flammable. And I'm not sure if it's going to be on an upcoming slide, but I can tell you that also particulate matter 2.5 from wildfire smoke has 10 times greater effect on one's health conditions than PM 2.5 caused by regular pollution. Now, in this slide, what I wanted to share with you is that our Live Well San Diego indicators, we look at the physical environment specifically focused on air quality. And this is indicator number 7. Air quality is measured as the ratio of days that air quality is rated unhealthy. And the Air Pollution Control District conducts these measurements, and you can go to their website and you can see for the past day what the air quality level is rated. And I would encourage you to take a look at that if you haven't seen it before. In this particular slide, though, in San Diego County, the air quality was rated poorly on 13.4% of days in 2020, which is a total of 49 days for the year. So we are tracking this again, as I think in the prior slide, the air quality overall in California and in San Diego has improved, but it still can be improved even more. Now, this particular slide shows San Diego vulnerability to wildfires and particulate matter 2.5. This is a particular tool called the Cal Enviro Screen. So basically, this is the entire, well, the southern part of California. The legend here, the very dark, the darker the area, the worse. Particulate matter 2.5, you will see the lighter, the better. And you can see here in San Diego County at the border, the condition for particulate matter is much worse than the rest of the county. Now I'll go to vector-borne diseases. And it's important to know that there are a lot of different types of vector-borne diseases, but the one that affects us most here in San Diego is the mosquito. Mosquitoes and other vectors, and let me define vector first, means an animal like a mosquito or tick or a rodent can transmit causative agents, viruses, to cause human disease. Climate change can affect these vectors, their pathogens, and their hosts. So there is overlay between these three. And our Department of our County Vector Control Program, which is a part of our Department of Environmental Health and Quality, is the county department that works primarily on addressing these issues. When there is human involvement, then the public health department becomes involved. So these two departments work very closely together because the primary goal is to prevent disease. This is a list of many diseases that are transmitted by various vectors. The ones particularly transmitted by mosquitoes include yellow fever, West Nile virus, Zika. In 2016, we were seeing individuals that travel to endemic areas and return to San Diego with Zika. That has since subsided. This was important because in 2014, there were mosquitoes, the Aedes species arrived in San Diego, and this species is the species particularly responsible for transmitting Zika, dengue, chikungunya, as well as yellow fever. So when we have an exacerbation of the heat, we have a change in our ecosystem and habits. The vector season lengthens for many species. Our geographic range of vectors may expand. The breeding pattern of our vectors change, and all of these factors can be associated with an increase in disease transmission. The mosquito life cycle is dependent upon water and the temperature. It only takes a teaspoon of water for a mosquito to lay its eggs. So it's very important. And if you go to Fight the Bite website that's posted by and managed by the Department of Environmental Health and Quality, you will see that the messaging there is to always make sure that there is no standing water around your home. Climate change can cause irrigation, can increase breeding sources around the home. So we talked about making sure that there is no standing water. Increase the temperature. Increased temperature can speed up the life cycle of our vectors, particularly mosquitoes, as we have stated before. Now, another mosquito that was first identified in San Diego that was transmitted from the East Coast to the West Coast through birds was the Culex mosquito, which is responsible for transmitting West Nile virus. So the higher temperatures are correlated with increased prevalence of West Nile virus in Southern California. And that occurred in 2003. And so that was the Culex for West Nile virus. Then fast forward to 2014, we began to see 3 new species of the Aedes aegypti mosquitoes. This is an invasive mosquito because San Diego is not an endemic area for this mosquito. They were transmitted here in tires on ships, in tires with water in them, or other mechanisms, but they were transported from other areas. But now they are here. These are daytime biters, if you will, and they don't fly very far, only about a mile or a mile and a half radius. The Aedes aegypti mosquito arrived here in 2014, then the albopictus in 2015, and then the third species, the notoscriptus, arrived in 2018. And this map can be found on the Department of Environmental Health and Quality, and it shows specifically the 2 species that are currently identified. Even though all 3 arrived in San Diego, what has been detected now is primarily the Aedes aegypti, designated by the red dots, and then the green dot is the Aedes notoscriptus. And these mosquitoes are very unique. They have they're black and white stripes. So if you see one that looks like that, know that it's Aedes. So last, I want you to focus on the last part of the bottom right or bottom left of this slide. And this is information for the Department of Environmental Health and Quality, particularly the vector-borne department. And I would encourage you to visit, as I stated before, I think Fight the Bite. That is a great website with great tips and resources related to abating or mitigating mosquitoes in your area. So the third section, what has the County of San Diego done? And I'm not going to go through this in detail, but this is a timeline of our climate change and health equity activities over the past years, actually over the past 2 decades. And the important thing is that in 2021, in this next slide, we changed the name of our Office of Health Equity to the Office of Health, Equity, and Climate Change to reflect the work that we have been doing since 2015. Our Office of Health Equity and Climate Change has just robust relationships and partnerships with many organizations, from CDC at the national level to CDPH, California Department of Public Health, at the state level, and numerous local organizations. And I mentioned APCD, Air Pollution Control District, earlier, as well as the Department of Environmental Health and Quality, UCSD, USD, and SDSU. All are valued partners working on this climate change issue. And so now I return back to the BRACE, Building Resilience Against Climate Effects. These are the 5 components. I just wanted to share with you what we have done in those 5 areas. So step 1, forecasting climate impacts and assessing vulnerability. I showed you the vulnerability assessments from 2016 and 2021. Step 2 is projecting the disease burden. We are developing, in the process of developing white papers that look at excessive heat, wildfires and air quality, as well as vector-borne conditions. We will be developing one-pagers related to those 3 focus areas to explain what actions we are taking locally across those 3 areas. And then we will be issuing in this next fiscal year a climate and health adaptation plan. We've worked with the state on this plan, and we are excited about the opportunity to support our land use and environment group on the overall climate change plan for the County of San Diego. So what can you do? There are a lot of things that the general public can do, and the links that we have here are just some examples of resources. I showed you the Chivis vulnerability indicator. Individuals can go in and type in their county, and just as I showed you the information related to San Diego County, other areas or counties throughout the state can get their information. So these are all, again, just resources. We showed you the Cal Enviro scan. You can go in and play with that. We can check air quality to know what's going on in your location, as well as the local pollen count that might be seen or occurring in your area. And then locally, you can join local collaborations and partner for collective impact. Some examples include our San Diego Regional Climate Collaborative. We have a partner relay that is focused on non-English speaking communities. There are 8 language communities where, when we have disasters, we partner with the representatives, and they translate information and push it out to our or their constituents. So that's very important. And we developed this particular program after the blackout or the outage in September of 2011, when some communities didn't know what was going on. So it became very important that we address that particular issue. And then you can discuss risks and encourage the use of our county cool zones. I shared that information with you earlier. Consider a network of clean air centers. Register for emergency alerts. You can get those through the county. And then you can also install the various emergency apps on your phone, so you can get that information from our county office of emergency services. And then lastly, I'd encourage everyone to complete their family disaster plan. That will be very important. I'm not going to go through all of these others, but these are resources and tools, trainings, grants, legislative bills that are relevant to climate change and excessive heat. And then there are just more resources. Resources are abundant. So we would encourage you to take a look at all of these lists from the federal level to the state level and even again at our local level. So with that, I will thank you for the opportunity to speak with you tonight, and happy to take any questions anyone might have.
We have one question in the chat.
Sure.
Does the state offer any protections to farm workers against high temperatures or requirements for employers to provide water?
I'm not aware of any legislation of that nature, but it's certainly an important one. The data that I shared with you about workers, many of San Diego County, we have a lot of migrant workers here. So I think that's a very important question. And but I don't know of any resources that are available or legislation that has an impact on those actions that you are suggesting. But certainly it makes sense that that would take place.
Thank you.
And I see here on my slides online where we can assess them. Absolutely. I will make sure that the slides are made available to Deanna so that she can share them with you. Thank you.
Great, thanks. Harriet had a question. Do you want to ask your question, Harriet? Oh, I'm sorry, she just answered that. Deanna, what about your bat question?
Okay, I've had bats living outside my house for years. They come in early March and leave just before Halloween. They occupy the outside front entry of my house and the covered patio covers also. And I know they eat mosquitoes, but I know they also carry disease.
Mm-hmm. Yeah, bats are increasingly becoming or being seen as a vector. You're absolutely right. They can carry disease. So it is very, very, very important. Disease, they can carry germs and parasites. So it's very important that, and we get these reports all the time at the safari park. If you see a bat, do not touch it. Don't try to pick it up. Call animal control so that, which is your county department, so they can send someone out to collect the animal. Because what we want to do, what happens then is that that animal is actually brought to our public health laboratory, and we test it for rabies, because that's what's important. Because if people have had contact with that bat, then they have to be assessed as well. So it's very, very important. Never, ever touch or try to engage bats if you see them.
Okay, Wilma, they come to my house to procreate, and I have lots of bats. So animal control would have to come and somehow capture all these.
I would just call animal control and tell them what your situation is, and they can advise you accordingly.
Okay, thank you.
Yes, absolutely.
Nancy had a question about cooling stations.
Yes.
Nancy, do you want to ask your question?
Yes, Dr. Wooten. Do we compare favorably to the number of cooling stations, or I just worry about all the people I don't know that are out there? And
Yeah, sure. Well, we have over 60, as was reported today by the Department of Aging and Independence. services, but we're asking for more. And that was one of the asks this morning by our agency director, Nick Mascione, who's today is his last day, as many of you may know. He's going to work at UCSD. So we have 60, certainly with a population of over 3.3 million people, and just over 56% having air conditioners, a large number of people that don't have air conditioning. So the more cool zones we can identify, the better for our San Diego community.
We actually have 2 of them here in Fallbrook for 32,000 people. So presuming that half of people here don't have air conditioners, that would be 16,000 people and 2 cooling centers.
Yes.
And they're only open during business hours, like the library is open during library hours and the community center is only open during the community hours. So it's not ideal.
When we have, very high temperatures, like if the temperatures are greater than or around 100 in the desert and mountainous areas, Borrego has been a great at doing this. They will extend their hours, particularly on the weekends. Now, I know it may not be enough, but they will extend their hours. And that's one of the things that we identify as a strategy when we have the really high temperatures and we convene our task force. That's one of the actions we will take.
Because actually, as far as I know, our library does not extend its hours. And we've had some really hot days when it was Sunday, and they're not open on Sunday. So they simply weren't available as a cooling center. That's just over the last few years that I've lived here.
Yeah, it depends upon if there is a heat warning, they would extend the hours. If it's just an advisory or an alert, most likely they will not. It is only for the extreme conditions.
Is it always in the library? That's my question.
No, other areas will volunteer to be cool zones. Malls are cool zones as well. Our county libraries, as well as our city libraries, have volunteered to be, all of our county libraries are cool zones, but other city libraries have also volunteered.
Here in Fallbrook, we basically just have the 2, the library and the community center on Heald. The 2 that are identified.
Sure. Maybe that might be identified as something that your group could do, is maybe identify other locations in the Fallbrook area that could serve as cool zones.
One of the reasons some of us live here is because there are no malls. So
yes.
Maybe the hardware store. I don't know.
Well, maybe the health and wellness center. How about that?
Yes. Why not?
I think schools would be a good
And
choice.
schools is another.
Yeah.
Absolutely. Mm-hmm.
Yeah. Okay, maybe we should work on that, form our own task force. Marcia Stewart had a question. Marcia, are you there?
He's muted.
Yes, Marcia states that the homeless would be particularly vulnerable to heat and air quality, and she's absolutely right. The question is, what programs are there to help them with these threats? So we have a new department in Health and Human Services Agency, and it is the Office of Homeless Solutions and Equitable Communities. It's a long name, but Homeless Solutions and Equitable Communities. So we certainly have shelters where people can look to register so that they can be a guest there. That's one solution or strategy. But, it's difficult with our homeless population. Sometimes they don't want to be in shelters. So we have to meet people where they are. We have foot teams that go out into the river beds. Our primary reason for going out at this point in time, and actually since 2017 and when our foot team started, is to deliver vaccinations for Hep A, because that is a health condition that impacts our homeless population. But we also try to educate them on other factors. So carrying water out and dispensing that, as well as other information, is what we do currently at the county, and to make sure that they have, whether it's flu vaccine or vaccinations for Hep A, and just to do education as needed. We do that with our foot teams that are deployed throughout the county.
Well, maybe we have time for one. Harriet and Deanna had a similar question about the numbers, about hospitalizations and heat-related deaths compared to other states. Do one of you want to jump and ask your question, Harriet or Deanna?
Sure, I can.
Okay.
You know, it can be misleading if you're just looking at the total number of deaths related to heat or something else. But if you look at the number of heat-related deaths, for example, per 100,000, that has more meaning as to how bad it is.
Well, when we utilize a number per 100,000, usually we're talking about rates. So that's not the number, that's a proportion. Well, the numbers are a proportion, but this is looking at a rate taking into account age, and it is by 100,000 population. So it is a rate per 100,000, not the actual number per 100,000.
Because I would have thought Arizona and New Mexico would have been worse.
And are you talking about the slide where it showed hospitalizations? Yes, yes. Good point. But that study showed, with the exception of one hospitalization where New York was number one, we were number 7. And I don't have the capacity to go back, but I would imagine that those states are probably in the top 10 as well.
Because Texas has really, Texas has a smaller population than we do, but really, like the brutal hate wave that they're having right now.
Yes.
You know, it's on a per capita basis. I would expect them to be a lot worse, just because it doesn't cool down at night. I mean, I lived there for several years.
Sure.
At 10 o'clock at night, it would still be 85 degrees and 90% humidity, and it was grim. You had to have air conditioning.
And in cities, many of you may remember in 2006, we saw a lot of deaths in Chicago, New York. And it's again that the concrete jungle, if you will, because you have so much concrete and high rises, and it just holds on to the heat. So that's what we tried to convey with the slide that shows the elevation of the temperature in urban areas during daytime as well as at nighttime, higher than any other areas.
Yeah, even Seattle and Portland had a lot of people dying of heat in these last few years.
Yes.
Because nobody has air conditioning there. When we lived there, we had to come down here to get air conditioning. Because we just never thought of getting it up there, but we knew we had to have it down here. So I want to thank you for all the work you did during COVID in keeping us safe and giving us accurate information every day.
Thank you so much.
In the daily health information show. you know, that was really helpful
Thank you.
for us to know what was going on with really getting the best information. So I want to thank you for that.
Well, as a county employee, and I speak on behalf of my team and the employees in public health, as well as the agency, it really was a team effort. Everyone pitched in, stepped away from their routine jobs to address COVID-19. So that is what, as a civil servant, that's what we do, and we are happy to do it. Yes, thank you.
Right.
Yes.
And the vaccination program.
Mhm.
That was really outstanding too. Helping to get those vaccines out and publicized for everybody to be able to get. And to get them out to to all the folks in Fallbrook, we had a lot of, I don't know what you call it, but vaccination programs where some of the groups that like CAL FIRE and
Yes.
some of the other groups that work with migrant workers, they came out to do special days that I'm sure that saved many lives.
Absolutely. Yeah, we were very proud of that program where we had mobile teams, primarily EMTs and paramedics,
Mhm.
going around to the rural areas, vaccinating migrant workers and others that couldn't readily get to a vaccination site. So yeah, we
Right.
were very proud of that program.
Right. Yeah, they went to individual nurseries in Fallbrook and Rainbow.
Yes, yes.
Yeah, that was great. So I want to just thank you for coming tonight. Your information was outstanding, and I'm sure other people feel the same way.
Thank you so
Well-
very much. Certainly our pleasure, and happy to come to your group at any other time with other topics that our staff can provide. So just let us know. We appreciated the opportunity to share this information with you tonight.
Well, thank you, Dr. Wooten. We really.
All right. Take care. Have a good evening, everyone.
All
Yes,
right.
thank you so much.
All right.
Yes. Bye-bye.
Bye.
Thanks. Bye, everybody.
Bye.
Bye-bye.